What is the definition of nursing? This short presentation is an excerpt from the three-question method of clinical preparation for nursing students, which is a narrated PowerPoint presentation. This short narrated PowerPoint answers the questions, what does a nurse do, and what is the work of a nurse? Because the three-question method highlights the work of a nurse, I prefaced clinicals with two discussions on the first clinical day. One of the first questions I would ask my students is, what is the definition of nursing? The response would often be blank stares and puzzled looks. Why is she asking this question? It's a trick. But no one could articulate in an elevator speech what nursing is. I love this poster because I believe there is some truth. Maybe it would be better to ask your friends and family their definition of what a nurse does. Undoubtedly, your students have this publication and have read it. The American Nurses Association thoroughly spells out the work of a professional nurse in these standards of practice. Here is the table of contents list of the standards. But how does a student articulate in a very brief statement the work of a nurse? The definition of nursing can be found on the ANA website, nursingworld.org. Listed are these key responsibilities: perform physical exams and health histories before making critical decisions, provide health promotion, counseling, and education, administer medications and other personalized interventions, coordinate care in collaboration with a wide array of healthcare professionals. These key responsibilities can be shortened. Nurses are responsible for assessments, health promotion, tasks, and collaboration with other healthcare team members. Here is a chart that compares nursing and medical diagnoses. The work of a care provider is, as we know, different from the work of a nurse. Both professions offer essential members to the healthcare team. The best outcomes are obtained through the collaborative and cooperative work of the entire healthcare team. And as you can see on this chart, the term human response is listed 3 times in the nursing diagnosis column and not at all in the medical diagnosis column. Boiling the definition of what a nurse does down even further for my students, I would sum up the work of a professional nurse as this: nurses treat the human response to a medical condition and promote health. The short statement was easier to remember, and I would emphasize that those 2 elements underpin and drive the work of a professional nurse. When I saw my students struggling to grasp their responsibility as a nurse, I would use an illustration. I would say to the student next to me, "What would happen if I broke your arm?" After the initial gasps and obvious shock, the students would start shouting out, "Well, there would be pain. She would be angry at you. She would be afraid of you. There would be blood loss at the fracture site and swelling." I would point out that everything they said was a human response to the medical diagnosis of a fracture. We would then frame the discussion into nursing diagnosis and actions. There would be no confusion between the fundamental work of a nurse and the fundamental work of a care provider, between a nursing diagnosis and a medical diagnosis. The very first time I used this illustration with a group of students in post-conference, it was because I saw them struggling to grasp the true and important work of a nurse. They were thinking their job as a nurse was complete when they carried out the care provider orders. Knowing the work of a professional nurse well defines the scope of practice, promoting safe practice.